Okay, speaking of staying fit, this is something that's going to make you feel better, especially if you don't feel great. It's time to talk about the latest advancements in arthroscopy, and that's why Dr. Jovan Laskovski is here from Crystal Clinic Orthopaedic Center. And we could be talking about elbows, shoulders, hips, knees, all those things fall in that orthopedic line then, huh?
Correct. So my subspecialty is hip arthroscopy, which is really kind of a new, one of the later or greater innovations in orthopedics. So my practice is solely focused on that, and we do arthroscopic surgery of a number of different hip problems.
Okay, so I know when people, I remember when people get hip replacements in the old days.
Yep.
Yeah, they go to the hospital. They'd be in the hospital for a week. They wouldn't be back for a couple months, and that whole world has sort of changed, hasn't it?
Yeah. So the interesting thing about it is the vast majority of patients, it's a same-day surgery, and you end up really coming in the morning, leaving in the afternoon, and rather than making large open incisions, we can do the surgery through small little poke holes with a camera, and we can treat a variety of different problems.
So I mentioned hip replacement, so there are a whole bunch of different things about the hip that maybe it doesn't involve a replacement, but you can fix in an easier way.
Correct. So one of the interesting things is we get a number of different issues besides arthritis in the hip. We can get labral tears or cartilage tears. We can get torn tendons. And these are different injuries that don't require hip replacement. So we can go in through the scope and do a very precise, detailed repair of these injuries and be able to get people home the same day and then get them on the road to recovery and hopefully avoid having a hip replacement later on down the line.
Okay, there are a bunch of people sitting at home right now and they're watching this, and when the show's over, they're going to get up and they're going to be sore for a couple steps or something, then they're going to start to feel better as they're walking. Could they have a problem that you could fix?
Yeah, those are one of the more common early presenting issues. When we sit for quite a bit of time, we can get deep pain in the groin or on the outside of our hip, and we kind of get moving and going, and that pain subsides, but it can get worse and worse over time. So we've got a multitude of different diagnostic tools that we can use to kind of assess and figure out what that issue is for them.
Okay, I'm a tough guy. I like putting off things like that. I can put up with 2 or 3 steps that aren't good, and all of a sudden it's better and it's fine. Am I doing damage to myself that's going to make it get worse?
Not necessarily. Your body will let you know if it is getting worse. Pain will increase. Your function and ability to do the things that you love to do will get less and less over time. So all those things kind of lead us to say, okay, if it's pain with a step or two, not a huge deal, but when it starts to kind of invade life and you can't sleep, you can't exercise, you can't do your day-to-day activities, then things become a lot more difficult and something that you should look into.
So the name of the place is a Crystal Clinic, right?
Yep, Crystal Clinic Orthopaedic Center.
Okay, so I'm having a little bit of a problem. Do I need to go to a doctor to get a referral to you, or how do I do it? Just call you guys?
No, so you just call the direct line. We'll get you in touch depending on what your problem is. We've got a multitude of subspecialists that can take care of it. You know, I'm the guy who takes care of all the arthroscopic hip problems, but we have joint replacement surgeons, we have hand specialists, shoulder specialists, et cetera, so we can get you plugged in with the right doc to take care of it.
So we're going beyond the hips here. I mean, it's just about any orthopedic problem that you guys can cover that.
Yep.
That's excellent. How about insurance for those kind of things? Regular insurance covers that?
Yep, insurance typically covers it. You know, each insurance is a little bit different, so you just want to check with your insurance provider, and then our financial department can help you with all those things.
So next time someone says, I have a pain in the butt?
Yeah, I'm the pain in the butt guy.
There you go.
Yeah.
That's perfect. Thanks, Doc.